Dr. Cynthia Keator. I am the Medical Director of the Epilepsy Monitoring Unit here at the Jane and John Justin Neurosciences Department with Cook Children's Hospital. This is our playroom in our Epilepsy Monitoring Unit where I'm speaking to you today. Our Epilepsy Monitoring Unit is equipped with 10 rooms with video capability, with rooms already wired for electronic monitoring for the video EEGs. Makes it very convenient for our children and our families since they're not hooked up to the computers, they're just hooked up to the equipment, and it gives them freedom and range to walk around their room. Each bedroom has their own bathroom, so it makes it as private as we can for each family. The playroom is also equipped with video monitoring, so there are cameras in this room, so if the children want to be disconnected from the equipment in the room and come into the playroom, they can have a little bit more freedom, play with the Xbox, play with their families, or if they're siblings that come and visit, so it makes it a little bit more convenient to make it more of a real environment as if they were at home. What we do in the monitoring unit is that we obviously do video EEG monitoring for two main things. One is seizure characterization, for us to understand the event. Is it a seizure? Is it not a seizure? Make diagnosis of specific types of epilepsy syndromes. And in addition, one of our other main focuses here is obviously evaluation for surgical management. So for children who have intractable epilepsy, a great deal of time is spent for these patients in our monitoring unit, up to 1 to 2 weeks at times, to evaluate their seizures, capture their seizures, and do the studies that are needed to better understand if they are indeed a surgical candidate or not. So while the family is here, and while the patient is here, they usually will get hooked up either in the room or in our procedure room. They come back into their rooms where we start doing our job. Usually they're taking off their seizure medication, so sometimes quickly we get seizures and other times it takes a little bit longer. While they're here, we're not only capturing seizures, but we're also doing other studies. So some of them are getting cognitive testing with neuropsychology. Sometimes they're getting injections for their scans, so that might be a SPECT scan or a PET scan to better identify seizure foci. And then at the end of the study, the results are usually reviewed with the physician at real time. So one of the advantages is that we are monitoring real time, and we have EEG technicians here 24/7 to be notifying the team and the doctors should we have issues or are we seeing seizures, to be able to give that information real time to those families as well. Oftentimes the families are discharged and we later give them the results in one of our epilepsy conferences. And for a lot of these families, they come back and they meet us back in the monitoring unit when they come back for further surgeries, specifically for stereotactic EEG placement, where they have electrodes stereotactically placed with a robot and a neurosurgeon in the operating room. And then they come back to the EMU where we have the leads already placed inside their brain, and we are watching their seizures again real time. So the families become very used to our unit and to the nurses and the staff. So we try to make it as comfortable as we can, almost like a second home if at all possible.